This is Eva Gibson. I'm doing my newborn assessment video. This is baby Sarah. First, I would introduce myself to the parents and family in the room, and I would explain to them that I will be assessing baby Sarah and making sure that everything is looking good with her. And I want to make sure I gather all the necessary supplies such as my stethoscope, pen light, tape measure, and gloves that I may need. And then I'm going to perform hand hygiene. And while I do that, I'll tell you a little bit about baby Sarah. She was born 10 hours ago, vaginally, with no complications. She's doing great so far. And I want to make sure I provide privacy. And baby Sarah is Caucasian, and so I'm going to observe her color, which is pink. And if she was just born, she could be red and a little swollen just because of the trauma that is happening when the baby is being born vaginally. And then I'm going to observe baby Sarah's posture, and her elbows right here are a little flexed, which is normal, and that's good. And then I'm going to assess baby Sarah's posture. I meant proportion. So her head is 1/4 of her body, which is normal, and that's good. And then I'm going to assess baby Sarah's movement. So I'm going to touch baby Sarah a little bit, and she moves around equally and bilaterally, which is appropriate and good. And as I'm looking at her skin, I'm making sure there's no bruising, star bites, or mela present, which there's none. And then I'm going to put on my gloves, and I'm going to weigh baby Sarah. And the normal range for newborn's weight is 2,500 to 4,000 grams. And baby Sarah weighs about 3,000 grams. And then I'm going to measure baby Sarah's length from the very top of her head to the bottom of her foot. And I'm going to measure it in centimeters. And the normal range for newborns is usually 48 to 53 centimeters. And baby Sarah is 50 centimeters. And then I'm going to measure baby Sarah's head circumference. And the normal range is usually 32 to 36 centimeters. And I'm going to support her neck as I raise her head because babies' heads can be floppy. And we want to make sure we don't damage anything with baby Sarah. So we're going to lift her head up a little bit, and we're going to apply the tape measure underneath. And we're going to put the tape measure around the widest part of baby Sarah's head. And we're going to come around to the front of the eyebrows and measure. And baby Sarah measures 33 centimeters. And we're going to take that out. And then we're going to measure baby Sarah's chest circumference, which normally the average range is 30.5 to 33 centimeters. And I'm going to lift baby Sarah up and put the tape measure underneath her. And I'm going to make sure it's against her skin. And I'm going to come around to the nipples, to the middle of her nipple line. And she measures around 31 centimeters, which is normal. And then I'm going to take the tape measure off and assess baby Sarah's respiratory rate. And I'm going to put my hand on baby Sarah's chest just to feel the rise and fall because it can be irregular sometimes with newborns. And usually the normal respiration rate is 30 to 60 breaths per minute with newborns. So I'm going to listen for 1 full minute. 145 breaths per minute, which is normal. And as we do that, next we're going to listen to baby Sarah's breath sounds, and we're gonna be using either the pediatric stethoscope or the bell of the stethoscope instead of the diaphragm, because if we use the diaphragm, being that babies are so small and compacted, their organs are also small and compacted, and if we use the diaphragm, we'll just be able to hear all of them and won't be able to hear exactly what we want to listen to. So that's why we use the bell of the stethoscope. And we also want to assess for any respiratory distress, which that could include any retraction, any circumoral stenosis, nasal flaring, tachypnea, any grunting, elevated respirations, asymmetrical rise and fall of the chest, are signs of respiratory distress. So we're gonna listen. And we're also gonna listen to the ones on the side. Okay. And baby Sarah's breath sounds were clear. And if baby Sarah was born via C-section or cesarean birth, her breath sounds could be affected because when a baby is born vaginally, that the squeezing of the vagina helps excrete any liquid outside of the lungs, and if she was born via C-section, then that squeezing and compaction would not happen, so that could affect the lung sounds in the end. So just a little bit of information. Next, we want to assess baby Sarah's cardiac system. So we want to count her pulse for 1 full minute. And the normal range is normally 120 to 160 beats per minute. And her apical pulse is going to be lateral on the left side, about the third or fourth intercostal space. And so we're going to listen to those now, and we want to use the bell also. Alright, and I got 140 beats per minute, which is normal. And next, I want to assess baby Sarah's pulses. So I want to assess her brachial pulses and her femoral pulses. And I want to do this at the same time as well. And I want to assess her rhythm rate and strength. I feel those. And I would say those are equal and normal. at a +2 in strength. And her femoral pulses are also equal to normal and a +2 in strength, which is great. And normally we don't assess newborns' blood pressure unless they're showing any signs of cardiac problems. And normally the systolic blood pressure would be 65 to 95, and the systolic would be 30 to 60. So we're not gonna take baby Sarah's blood pressure because she's not showing any signs of cardiac problems. And next we wanna assess baby Sarah's suture lines, or head for her suture lines. And we wanna make sure they're not overlapping and they're well approximated, which they are. And we want to assess her fontanelles as well. So she has an interior fontanelle, which is in the front, and it's a diamond shape. And she also has a fontanelle in the back, which is posteriorly. And it's more of a triangle shape, and it's a little smaller. And if we see any sunken fontanelles, then that may indicate possible dehydration. And if there's any bulging fontanelles, then there could be increased cranial pressure or excessive fluid in there. And then if baby Sarah had a caput septennium, that means a cone-shaped head, because she was born vaginally, then it would usually take, like resolve itself very quickly within several days. And cephalic hematoma is a bleed in between the parietal skull and the scalp, and it can be on one side or on both, and it usually develops 24 to 48 hours after birth, and it stays within the suture lines, well approximated, and it takes a couple of weeks to a couple of months for that to resolve. And then we're gonna assess baby Sarah's eyes. I want to look at the color. So baby Sarah's eyes are like a slate gray in color, which is normal. And her sclera is white, which is great. We love that, because if it was if it was yellow, then that could indicate jaundice, and that's not a good sign. So we want to look at that, and then we want to assess her pupils and make sure they're equal, round, and reactive to light. So we're gonna do that. And baby Sarah's eyes are equal, round, and reactive. And being that baby Sarah is a newborn, we won't be able to test for any accommodations right now, because she can't see very far. Newborns can't see very far to test for any accommodations. So we'll wait on that. And then we're gonna assess the top of the pinna. And so the top of the pinna should align with the outer edges of baby Sarah's eyes. And they do. And we just want to make sure that her pinna isn't like lower or higher than the outer edges of her eye, which they weren't. And then we're gonna look for any pre-auricular skin tags, because if there is any on her ears, then that could indicate a renal malfunction. And then we're gonna assess the patency of baby Sarah's nostrils. So we're gonna close her mouth and take one finger and close the nostril. I'm gonna take the other hand and see if we feel any breathing or air coming out of that other nostril, which we do. We're going to do the same thing with the other side. Close the mouth and close the nose and feel. And here, and we feel airflow. So that's great. Then we're going to assess baby Sierra's mouth. And I'm gonna assess her rooting reflex. So I'm gonna put my pinky in her mouth, and if she starts sucking on my pinky, she has a positive, strong rooting reflex. So we're gonna try that. And she does. And so baby Sierra has a strong rooting reflex. And then we're gonna assess her face and make sure everything's symmetrical. Her eyes, her mouth, her nose, and everything is symmetrical. And if there was anything off, that could indicate an injury to a facial nerve. So we want to make sure we find those if there's any present. And then we're going to assess her inside of her mouth. And we can like look in there and see if there's any Epstein pearls. And if there is, that's normal. And if baby Sierra, if there's any circummoral stenosis present while she's crying, then that may indicate that she has a congenital heart defect. So we want to be on the lookout for that if baby Sierra happens to cry. And then we want to assess her neck, and it should be short with thick skin folds, which it is. And we want to move her neck from side to side, and it moves easily without any resistance. And she also has a little we want to assess for any webbing or fat pads, because if she has any, then we would want to report those because they would be abnormal findings. And then we want to assess baby Sierra's chest and clavicle. So, because during the birthing process, vaginally, clavicles will sometimes be fractured in newborns because of that compression and squeezing. So I want to take my finger and run it along baby Sierra's clavicle and feel for any lumps or bumps, which I don't feel any. And I'm going to do the other side, and that's normal. And we want to assess her chest shape and make sure it's cylindrical in appearance, which it is. And then we want to assess baby Sierra's nipples and make sure she doesn't have any more or any less than she needs, and make sure they're well approximated. And baby Sierra does have 2 nipples, and they are where they are approximately supposed to be, and they're symmetrical, so that's great. Next we want to assess baby Sierra's abdomen, and we always want to listen before we start palpating. And we're going to start at the right lower quadrant, and we're going to go up, over, and down. And if we do hear bowel sounds, that indicates peristalsis. And if she was just born, then there may not be any there. But we're going to listen and see if we hear any. We're going to use the bell. Alright, and we do hear just a little bit of bowel sounds, which is normal for baby Sierra. And we also want to assess her umbilical cord, okay? So it has 2 arteries and 1 vein, and it's a little brownish, which is fine. If baby Sierra was just born, it may be bluish or whitish in color, and over time it darkens, and eventually it will fall off. And we want to make sure that there's no bulging on it, because if there was any bulging on the umbilical cord, then that could indicate an umbilical hernia. So baby Sierra does not have any lumps or bumps on that, which is great. And next we want to assess baby Sarah's motor reflex. So I'm gonna take my fingers and lift baby Sarah's head just a little bit until the feedback touches the surface. And I'm gonna let go and see what baby Sarah does. So I'm gonna get her to grab my hands and I'm gonna lift her head just a little and let go. And baby Sarah's hands and fingers spread out, which is normal. That's a positive motor reflex and we like that. And next we're gonna assess baby Sarah for any hip dysplasia. So we're gonna take her hips and we're just gonna go up and around and rotate her hips like that. And we're gonna listen for any clicks. We could do this at the same time as well. And I don't hear any clicks with baby Sarah, which is great. And then we're gonna assess baby Sarah's palmar reflex. So I'm gonna put my fingers in her fingers and see if she will grab my fingers. And baby Sarah does, which is great. She has a positive palmar reflex, and we're gonna assess her creases in her hands too. And baby Sarah has multiple creases in her hand, which is normal. But if she only had one crease in her hand, then that would be Simmon crease. And then we're gonna look at her ankles and feet, and we're gonna see if she has any polydactyl or webbing. So any extra digits or any extra skin in between the toes. And baby Sarah's toes are normal. She has 5 toes, so that's all good. And then we're gonna assess her plantar grasp, which is basically like the palmar reflex, but with the toes. So I'm gonna see if baby Sarah will grasp my toes with her, or grasp my finger with her toes. And she does, which is great. And then we're gonna assess baby Sarah's Babinski reflex. So I'm gonna take my finger and I'm going to start on the heel of baby Sarah's, and on the outer edge of her foot, I'm gonna go up and see if her toes spread out. And if it does, it's positive. And baby Sarah's toes does spread out, so she does have a positive Babinski reflex, which is great. And next we're gonna assess baby Sarah's back. So we're gonna wanna make sure that her neck is supported. And we're gonna pick her up kind of like we're gonna do CPR on her. And turn around. Okay. And so as we're looking at baby Sarah's back, we wanna look at her spinal column and assess and see if we see any hair. Because if there was any hair, that could indicate spinal bifida occulta, and we want to look for any dimpling because that could indicate polydontal cyst. And we want to assess her buttocks and make sure the folds are symmetrical and her legs are equal in length. And we want to note if there's any Mongolian spots present on her back, which there isn't. And so we want to lay baby Sarah back down. And next we want to assess baby Sarah's genitals. And her labia may be a little swollen, but if we see any burn X or any small amount of vaginal discharge or bleeding, that's normal due to the mother's hormones. And we want, if baby Sarah, if she was male, we would assess the scrotum and palpate the testes and observe for any epispadias or hypospadias, just to make sure the urethra is in the right spot. And we want to assert the anus and make sure there is anus and make sure there's not any fissures. And after that, we want to wrap baby Sarah back up in her diaper and her blanket. And then we want to return her back to mom and dad. And we want to wash our hands and make sure that parents have the call bell. And that's all for our newborn assessment.